I have the pleasure of introducing Susan Creasy, and for many of you, you've known.
When they asked me if I would consider chairing the next campaign, I do have a commitment to the hospital, and on all three hospitals, and have been very fortunate in that I haven't had to have a lot of care. I've had some family that have had great care, and I do believe that we have to support the needs of our hospital organizations. Clearly there's a numerical goal, and so my goal would be to achieve that and achieve it as quickly as possible. You know, we may have a 3 to 5 year time frame, and I'm a bit of a let's get it done and get it going, and that's the way I operate. And I'm very goal oriented in my business. I'm very accountable to goals in my business, and so I'm hoping that I can transfer some of those skills and those coaching sort of experiences that I've had into the foundation process, and I'm confident that we'll do it. Kingston is a wonderful community, and they're very supportive. I think that we as a community are a very strong community, and you know, when the call for help goes out, people jump, and it's not always the same people. And I think the opportunity to have state-of-the-art operating rooms at Kingston General Hospital, the opportunity of having state-of-the-art ORs at the Hotel Dieu for macular degeneration is something we should be really proud of and excited about, along with all the expanded emergency facilities and MRIs, etc. Because really we are not only a hospital or three hospitals, including the Providence, for Kingston. We serve a broader community from Cornwall to Belleville, from Smith Falls to Peterborough. And we're a trauma center, and we have a great medical school. We should be very proud of our medical school. And we have a great network of medical professionals here. And so I think if we can have state-of-the-art research facilities, state-of-the-art labs, we have the opportunity to have the best of the best coming to our medical schools to teach and to do research. I do believe you get what you give, and it's not just money, it's time and energy and experience and enthusiasm and consulting and expertise. So I do believe that if you live here and you work here, you have to give back to here. And it's just you know, I grew up in a family where my mom and dad volunteered. They were very committed to the CNIB, and my grandfather was chair of the committee that built Lake Joe, which is the CNIB national camp for blind children or sighted children. Less sighted children, I think is the correct word. So, you know, it's a bit in the blood, but it's part of life. And you know, my children at age 5 and 7 were in at black tie galas, setting tables and folding napkins, and that's just because that's the way you learn. You learn by doing, and it's important to be involved. I really am looking to the community to support us in whatever way they can for this campaign, because clearly the items that we're fundraising for, which I'm sure will be more clearly noted later, for all three hospitals, Providence Care, Hotel Dieu, and Kingston General, are really to end up at the end of the day to make our city and our lives and those of our parents and our generation. I'm a boomer generation, and you know, the reality is I probably will need the services more later in my lifetime of the hospitals that we have. And I think it's critical that we have the best. We should have the best. We deserve the best.
I am pleased to announce my own personal gift towards this next campaign. Over the next 5 years, I am committed to a gift of $100,000.